They've seen it one too many times before. A promising young girl at the head of her class gets pregnant and drops out of school. Or it might be a young boy who dabbles in drugs, only to get hooked and start living on the streets. Sponsored youth know all it takes is one wrong move to seal someone's fate forever, and they want to intervene before it's too late.
In the neighborhoods where we live, there is much misinformation, and many youth are in trouble and in difficult situations that cause us youth to lose ourselves further and further. So that's what's motivated me to be a leader, to be a person who can help other youth such as myself.
More than 1,700 sponsored youth have joined the Youth Health Corps since it was first mobilized in 2005. And they're taking to the streets to educate their peers about reproductive health, substance abuse, and other crucial topics related to health and hygiene. After receiving training on how to share sensitive health information, these peer educators have reached out to more than 350,000 young people with vital information that might very well save their future.
One time there was a talk, and after it was over, a youth approached me and told me how thankful he was that these messages were reaching his neighborhood, that the information was reaching other youth. He told me that he would share that information with his friends. And this is something that makes me happy, because it doesn't just stay with one person, but spreads to other youth.
As peer educators gain an understanding of their personal health concerns, they also encounter stereotypes and misconceptions about social issues and illnesses, which they confront head-on, says YHC facilitator Sandra Fantalgo.
One of these interactions was a field practice activity that was carried out with the youth educators. We visited a foundation called Franco Isabel Freño that works with children with HIV/AIDS. We visited with members of the YHC, the educators, and they interacted with children who are infected with HIV/AIDS. They performed activities and games. The youth were very impressed. It touched them and increased their sensitivity.
By spreading their message about safe health and hygiene throughout their neighborhoods, the Youth Health Corps is taking great strides toward curbing several social issues that threaten to consume poor communities.
The changes in the community I have noticed since the Youth Health Corps was implemented are many. Among those, I can highlight how the youth continue to change their attitudes, how their knowledge has increased on topics like drug prevention, teen pregnancy, and sexually transmitted infections. Something really particular is teen pregnancy or marriage at an early age, because in our communities, the custom exists that if you reach the age of 16 or 17, you have to get married. But through this program, they reflect on it and realize that they are not old enough to assume the responsibility of a marriage. And this has had an impact on the youth who participate. There is a notable change in them.
This knowledge that we acquire throughout the whole year is useful in life because it prepares us, physically and mentally, to not make mistakes and not to ruin our lives later on, and to become professional, successful people.
I think the way the program has improved my future, first, is that I'm going to be a youth who is different than the others. I'm going to stop being a little kid and become a youth who has leadership skills, a youth who is looking forward, someone who wants to triumph in life.
The young men and women of the Youth Health Corps are stepping up to take a stand against the health risks that threaten to hobble their progress. And now that they've found their stride, a more promising future is sure to come.